This is group 3, and we did case study 3 on patient M. Group members include Catherine Shimnich, Steven Zakrisik, Jessica Klitsky, Jacob Noble, Cameron Pate, Ryan McFarland, Luan Tran, and Michaela Den Hartog. Here is our presentation. The reason for this encounter is to discuss 8-year-old patient M's option for treating her head lice, what non-prescription methods should be used to prevent reinfestation, and to prevent the lice from spreading to patient M's siblings.
So for the subjective background, patient M, who is an 8-year-old female, is reported by her dad to be seen scratching her head more than usual. Patient M says she did shower while at her cousin's house for the last 12 days, but she is still scratching her head. Patient M also reports to her dad that it feels like something is crawling on my head and it is really itchy. When looking closer at her hair, the dad saw little insects that look like lice in her hair. He states that patient M has no drug allergies and is not currently taking any medications. He wants to know how to treat the lice and how to prevent spreading the lice to her siblings. Since patient M is 8 years old, her social, drug, alcohol, tobacco, and caffeine use was not collected during the interaction.
After talking with patient M's dad, there was no information collected on the immunizations or alerts of our patient. He did state that there are no known drug allergies and that patient M is not taking any medications currently. There was no objective background obtained during the patient interview, such as temperature, blood pressure, heart rate, weight, height, or quantitative measurements of the patient's current disease state. We determined that our indication was head lice infestation. Our goals of therapy include eliminating patient M's scalp itchiness symptoms from lice within 10 days, and also to eliminate patient M's scalp infestation of lice within 10 days. Our drug therapy problem was indication. She needs additional drug therapy, and it was stated as patient M needs additional drug therapy to treat the symptoms of her untreated head lice infestation. Our therapeutic options include lice-free spray, Rid Lice Treatment Complete Kit, and Nix Ultra Lice Removal Kit.
Now let's talk about the pharmacotherapy plan for patient M. The indication is head lice infestation. From the therapeutic options above, we pick lice-free spray for patient M. The active ingredient is sodium chloride, USP 1%. Parents should use enough of the solution and thoroughly saturate the hair and scalp. It is for external use only. It may be used as often as desired until there's no sign of head lice and nits. The specific directions include 6 steps. Step 1. Shake the bottle well. Step 2. Hold the bottle 4 to 6 inches from head. Spray on dry hair and entire scalp, starting at the hairline and working inward toward the ground. Step 3. Thoroughly saturate all hair and scalp. All lice and nits must come in full contact with the products. Step 4. Use the professional nit comb included in the box or a fine-tooth comb to remove dead lice and nits. Step 5. For best results, allow the product to air dry naturally. Do not rinse out. Step 6. Washing hair regularly to avoid product buildup.
This product should only be used by M and should not be used by other people or siblings in the family. The parents should check M daily for lice infestation. When using this product, do not use it around the eyes or mucous membranes, such as inside the nose or mouth. Parents should tell M to close her eyes when applying this product. Tingling may occur during the first 10 minutes of application, but it should go away. Stop and ask the doctor if skin irritation or infection is present. When treatment is complete and all remaining lice and nits have been wiped away from the comb, seal it in a bag and containing the nits and lice. Soak the comb in hot water above 130 degrees Fahrenheit for 10 minutes. Parents should inspect the comb before any subsequent reuse.
All right, so
Alright, so our rationale between picking lice-free spray over all of our other contenders was because we kind of went down the rationale of, well, of course, all of these products, lice-free spray, Nix, and Rid, can be used in an 8-year-old child to treat head lice. However, lice-free spray and Nix Ultra are ovicidal, meaning that they can kill both the louse and the nits at the same time. So you wouldn't have to do a second treatment like you would in Rid. So narrowing it down to these two options, between lice-free spray and Nix Ultra, lice-free spray is actually a cheaper option and doesn't require the hair washing that Nix Ultra would. So with this, your parents of this child would not have to keep track of the time to do the multiple steps that Nix Ultra has. And lice-free spray has that active ingredient of sodium chloride, so washing the hair is not really necessarily required. And it also is a very convenient way for the child to be treated because it does not require any of the changes in shampooing or hair washing schedule overall. And that is why we chose the lice-free spray.
Other interventions. Methods that could be included to optimize drug therapy could be wet combing in combination with a hair conditioner and a fine-tooth comb. For example, using olive oil or a petrolatum occlusive dressing and wet combing with a knit comb. This would be an example of a non-drug therapeutic option. The patient should also avoid head-to-head contact at home and school. The patient should also not share their clothing, combs, towels, bed, or pillows with others. Around the home, the floor and furniture should be vacuumed frequently. For the affected clothes, they should be washed at least 130 degrees Fahrenheit or above and then put on dry, high heat for at least 20 minutes. For items that cannot be washed at those high temperatures, they should be sealed in an airtight bag for at least 2 weeks.
I have requested that the patient return to the pharmacy for a follow-up in 10 days after therapy has been initiated. At this appointment in 10 days, we will evaluate if nits are cleared and the itching has subsided. I will also assess patient M for allergic reaction to treatment such as hives, redness of the scalp, peeling of the skin, or excessive itchiness from treatment. I encourage the father to contact the pharmacy sooner if issues or concerns would arise.